This is the Dollemore Daily, and I'm Jesse Dollemore. So you may have seen this story about this Alabama doctor who put up a sign saying he's not going to treat people who are not vaccinated. Don't come to him if you get COVID, if you chose to not get vaccinated. And I want to talk about it because I think it has more far-reaching implications for... Look, it's an unpopular opinion that I'm going to give, and that's okay. Reasonable people can disagree, and I really want your opinion on this. But I'm going to read from this article. An Alabama doctor watched patients reject the coronavirus vaccine. Now he's refusing to treat them. And it's that refusal to treat that I take issue with. First, let's read a couple paragraphs from this, and then let's talk about it. In Alabama, where the nation's lowest vaccination rate has helped push the state closer to a record number of hospitalizations, a physician has sent a clear message to his patients. Don't come in for medical treatment if you are unvaccinated. Jason Valentine, a physician at Diagnostic and Medical Clinic Infirmary Health in Mobile, Alabama, posted a photo on Facebook this week of him pointing to a sign taped to a door informing patients of his new policy coming October 1st. Quote, Dr. Valentine will no longer see patients that are not vaccinated against COVID-19, the sign reads. Valentine wrote in the post, which has since been made private but was captured in online images, that there were, quote, no conspiracy theories, no excuses stopping anyone from being vaccinated, AL.com reported. The doctor, who said at least 3 unvaccinated patients have asked him where they could get a vaccine since he posted the photo, has remained resolute to those who have questioned his decision in recent days. If they asked why, I told them COVID is a miserable way to die, and I can't watch them die like that, wrote Valentine, who has specialized in family medicine with Diagnostic and Medical Clinic since 2008. So, listen, it is without a doubt a problem right now, the coronavirus. These charts are emblematic of that. New reported cases off the charts. Now, the thick red line is the running average. If you look above the 6,000 case mark per day, that's what it was yesterday. Alabama's not a populous state. Hospitalizations, same story. Same exact story. They are reaching the point, their highest levels. This is before, remember how bad it was last July? Not this past July, but the one before that, when everybody was afraid. It was a stressful situation. At least it was for me. That's when I moved to Washington to be with my daughter during her chemotherapy treatments. It was nerve-wracking. And then it peaked. It got even worse at the end of the year last year. Now that we have a vaccine, that number shouldn't be like that. It shouldn't be spiking. So I understand the motive here. I don't think there's ill intent with the doctor to say, I'm not going to be a part of that. But do we want our doctors picking and choosing who they treat? There is a very clear slippery slope here of what other things are doctors, if we leave it to them to treat, what else are they going to do? If someone disagrees with the LGBTQ community, are they going to choose not to treat them medically? If a doctor believes in it, has a deeply, firmly, closely held religious belief about divorce, are they not going to treat divorced people? This is not a decision for a physician. The Hippocratic Oath is do no harm, treat. You treat. You don't decide, oh, this guy was involved in gang violence. I'm not going to treat his gunshot wounds. He made the decision to do violent, dangerous activities. I'm not going to treat him. This guy fell from a plane and his chute didn't open. Look, he made the decision to do something dangerous. My hands are clean of this. I don't believe that's where we want to be. I don't believe we want to leave it to physicians. I believe his motives are pure. And this is a method, a motivation this is a method to motivate his patients to get the vaccine. I believe that. But it's not his job to choose who to treat and who not to. But I'd love to know what you think. You can call, leave me a brief voicemail, 714-576-4054. You can email me daily at dollemore.com. Thank you so much for your participation. Thanks for engaging with my content. I'd love to see you connect with me on social media, Twitter, Instagram, TikTok. Big things are coming. I've got a lot of plans for the channel, for the podcast. A lot of things are in the works, and it is with your support that I will be able to do that. And on that note, I would ask you to consider supporting my work here on the platform for as little as $2 a month, $1.99 a month. You can click the join button below the video, see what's involved, become a channel member here on YouTube. You can also go over to Patreon, go to patreon.com/IDoubtItPodcast and help support my work that way. Independent media is clearly very important these days. And it is voices like mine. Again, I say this all the time and I mean it. If I don't bring you as much value as someone else, take your $2 and go support that person. I'm sure they'd very much appreciate it, as I would. Anyway, I love you guys. I'll see you next time. Until I do, be genuine. Take care of one another.